class today?
Class was good. Thank you for helping me with everything. I don't feel so lost like I was before.
Yeah, anytime. I can help you anytime. I have no problem with that at all.
What's wrong? Why are you holding your stomach?
Oh, nothing. I have to go to the bathroom again.
Didn't you just go?
Yeah, I did. But I have. Oh my gosh, I have to go to the bathroom again.
I'm in here.
Is she gonna make it? Is she gonna make it?
Be quiet, Alina.
Is she gonna make it?
Stop it. Yes, I'm gonna make it. Be quiet. Oh, where are the keys? Oh. At this moment, she knew she blew it.
Overactive bladder happens mostly in women, but may occur in men. This is the urge to urinate, and it is difficult to control. And this may lead to involuntary loss of urine, known as incontinence. It may be embarrassing, or most times limit your activities, social life, and your work. Overactive bladder is characterized into urgency, frequency, nocturia, and urge incontinence.
What are the signs and symptoms?
The signs and symptoms are: 1, you feel the sudden urge to urinate and it is difficult to control. 2, you experience unintentional loss of urine immediately after the urgent need to urinate. 3, you urinate frequently, usually 8 or more times in 24 hours. 4, you wake up more times in the night to urinate. So even if you are able to get to the toilet on time, when you have the sense to urinate, the unexpected frequency to urinate and nighttime waking up will disrupt your life.
While taking oxybutynin, you may experience confusion, delirium, depression, dizziness, chest discomfort, hypertension, acetylation, abnormal or blurred vision, hot flashes, abdominal pain, anorexia, nausea, vomiting, arthritis, back pain, upper respiratory tract infection, decreased sweating, dry skin, or other side effects.
Oxybutynin drug interactions include CNS depressants, which increase sedation, ketoconazole, possibly altered total absorption rate and blood level of ketoconazole, opioid agonists, increased depressive effects on GI motility and bladder function, other anticholinergics, possibly decreased absorption of other drugs leading to decreased effectiveness, increased risk of frequency and severity of certain adverse reactions such as constipation, dry mouth, and somnolence. Parasympathomimetics, decreased antimuscarinic action of oxybutynin. Prokinetic agents such as metoclopramide possibly antagonized effects of prokinetic agents, and also alcohol use will increase sedation.
Mechanism of action for oxybutynin: exerts anti-muscarinic and potent direct antispasmodic actions on smooth muscle in the bladder and decreases detrusor muscle contractions. The result is increased bladder capacity and a decreased urge to void. Contraindications: acute hemorrhage, angle closure glaucoma, gastric retention, GI obstruction, hypersensitivity to oxybutynin or its components, ileus intestinal atony in debilitated or elderly patients, myasthenia gravis, obstructive uropathy, toxic megacolon with ulcerative colitis, urine retention.
So the doctor has diagnosed you with overactive bladder with symptoms of urge urinary frequency.
Well, what are my options from here?
Your options are the treatment of oxybutynin, which comes in tablet or transdermal patch form.
And is there a difference between the two?
Well, I'm glad you asked. Oxybutynin comes in tablet form as extended release ditropan XL. Ditropan XL is an antispasmodic muscarinic antagonist. It is an extended release tablet that contains 5 mg, 10 mg, or 15 mg of oxybutynin chloride, formulated as a once-a-day controlled release tablet for oral administration. Ditropan XL is used to treat overactive bladders with symptoms of urge urinary frequency. The recommended starting dose of ditropan XL is 5 or 10 mg once daily at approximately the same time each day. Dosage may be adjusted in 5 mg increments to achieve a balance of efficacy and tolerability up to a maximum of 30 mg a day. In general, dosage adjustment may proceed at approximately weekly intervals. Your other option is transdermal oxybutynin patch called Oxytrol. Oxytrol is a matrix-type transdermal system composed of 3 layers. Oxytrol is also a muscarinic antagonist that is indicated for the treatment of overactive bladder in men with symptoms of urge urinary frequency. Oxytrol comes in 3.9 mg a day, should be applied to dry, intact skin on the abdomen, hip, or buttock twice weekly every 3 to 4 days. A new application site should be selected with each new system to avoid reapplication to the same site within 7 days.
Well, in your experiences, which one is chosen more often and why? Is there a benefit to one over the other?
Well, according to clinical trials that were ran, transdermal oxybutynin is generally well tolerated in patients with overactive bladder. The majority of patients who discontinued transdermal oxybutynin treatment in 2 pivot trials did so because of application site reactions. However, none discontinued treatment because of dry mouth. Dry mouth was reported by 52.1% of participants given oxybutynin. Many patients discontinued use of extended release tablets due to the side effects of dry mouth.
I think I would rather try the patch.
Sounds great.